It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome to another edition of the Best Docs Network, featuring some of the best physicians in the entire Dallas-Fort Worth area that, of course, help change people's lives.
They certainly do, Jim. Like our first doctor, neurosurgeon Dr. Rebecca Dagnyack.
I woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me, and they gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing, and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
Professional hockey player Craig Menard shattered his wrist, but now he's back on the ice thanks to Dr. Steven Rou. To hear more about Craig's story and other life-changing stories, log on to bestdocsnetwork.com.
When we talk about reflux disease, we actually have a list of the typical symptoms and the list of atypical symptoms. And sometimes we even have patients that come in and they didn't realize that they were having reflux disease.
I had no symptoms whatsoever. The only reason they found out that I had it was because I had entered my 50s and it was time to get a colonoscopy. At that time, I decided to have both done, the endoscopy and the colonoscopy. That's how they found it, and I was totally shocked because I had no idea that I even had it.
We have a lot of people that don't realize that they have reflux disease, and it takes a little bit before they come to the realization that, you know, this is the entity that they're dealing with. And that's very important because having the right diagnosis is going to lead to the right treatment.
I had asked Dr. Ihde to explain it to me because I couldn't quite understand, you know, exactly what he was going to be doing. So now, with this surgery, I stand a great chance of living a normal life and eating what I want to eat.
First, we went in with little incisions and we were able to free up the stomach, close the diaphragm down to the right size. And then we use the newer procedure to create the valve to close off the esophagus so that she wouldn't have reflux. And that involves going down through the mouth into the stomach. We attach to the end of the esophagus, and then we fold the top part of the stomach, what we call the fundus, back onto the esophagus. And that creates sort of a flap valve. As the stomach expands, push the front wall of the esophagus against the back wall, closing it off so that the content in the stomach doesn't get into the esophagus, which is what reflux is. 2 weeks after surgery, her symptoms have been resolved. She's off of her medications and is working towards getting back to a normal diet. So she's very happy with the procedure, and I think it's a testament to the way the procedure works.
Just to know that he took care of that problem for me, and my stomach will open and close, you know, when I eat, my chances of living a longer life are so much greater.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Many of us live with pain, but you don't have to. Pama's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of Pama are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PamaInc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. Pama, pain freedom. Go to PamaInc.net.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
The procedures that I have been doing for a number of years that involve endoscopic approach are done on what's commonly called a neuroma, which is a swollen tender nerve up in the ball of the foot. It's very, very difficult to walk on at times. It's very painful.
I started having foot trouble probably in '04 and went to doctors and had several diagnosed with Martin's neuroma. It's a sharp pain up in the ball of your feet. You know, it was on both of them, and at various times it was different in pain. Sometimes it'd subside, sometimes it'd just be where you couldn't stand it.
We discussed with him the traditional approaches to these procedures. After a discussion with him, we did decide that since his conservative measures had failed, we chose as a team to do a endoscopic procedure.
I had surgery in May. Dr. Singleton did my right foot. I hadn't had a whole lot of pain in my right foot. I think it still needs to heal just a little bit, but it's pretty much pain-free. And then we just did my left foot last Thursday. And of course, it's definitely in the healing process. And I would not have had my left one done had my right one hadn't been successful.
After his procedures, he has told me that his pain has been resolving substantially, and he can start to walk and feel a whole lot of improvement.
He's a good guy. He doesn't beat around the bush. He tells you how it is.
His life has improved. His work has improved. He's not as fatigued because of the pain. And I think that with a little bit more time and healing, he should do very, very well. As a Pama physician, it's been one of my goals to provide pain freedom for various foot conditions, and it's been a very fulfilling part of my life.
Dr. Singleton, he's given me the pain freedom to do the things that I have normally enjoyed doing and hadn't been able to do in a while. You know, I hunt and fish a lot, which that's going to help me out there because I hadn't been able to do that either. I'm very thankful for him and his procedures and this clinic for getting me to where I'm going to be able to do that.
How do you know if the chest pain you're having is due to a heart attack or something that's not quite as serious? That's an important question. First of all, chest pain that's due to a heart attack is usually dull, not sharp like a knife. Usually comes on gradually, not suddenly. It's usually moderate, not severe, not mild, and often it will radiate to your left arm, into your neck, and is often accompanied by a cold sweat. Sometimes you'll become nauseated. Sometimes you can become short of breath. And generally, you just feel bad. People find themselves getting pale. Those are the symptoms of a classic heart-type pain that may indicate a heart attack is beginning to happen to you. There are other causes of chest pain that aren't nearly as bad, but those are the ones that are accompanied with heartburn and don't have the typical symptoms that I've just described.
I didn't know myself what multiple sclerosis was. I had 3 attacks actually, and the first one was when I was 19. I actually heard from my doctor, from Dr. Rou, that it was somewhat different than what the normal symptoms are for the disease. In my case, I had the hypersensitivity, so hair on my neck just felt like it was painful to have it sitting on my neck. So I had multiple tests to determine what I did have because it didn't really seem to point to multiple sclerosis.
With multiple sclerosis, it's basically a condition where your body starts attacking the myelin. So the myelin is destroyed and there is no communication between the nerve cells. A lot of patients have other symptoms such as weakness, numbness, and tingling, and sometimes they can present with bladder problems, muscle stiffness, and cramps.
I was diagnosed with relapsing remitting, which is that when you have attacks, you will come back to full function after your attack so that you don't have any permanent damage from it. You know, I didn't have any permanent damage at this point. I was in relapsing remitting, and that there was a very good chance that with the prescriptions and therapy that she could prescribe to me, that it wouldn't progress.
Beth is actually a very special patient for me because she is my youngest patient with multiple sclerosis. She came in with symptoms of numbness and tingling on her shoulder region. She kind of described it as a very odd sensation. And usually when people present that way, we always think of nerve problems or like a pinched nerve in the neck. And MS was a diagnosis that I did not suspect on her. She has relapsing remitting type of multiple sclerosis. And I diagnosed her over a year ago, and she's on one of the interferon medications, and she has been doing well. She hasn't had any major clinical exacerbations over the last year.
With Dr. Rou's help, I mainly feel more upbeat and relaxed toward my future, that I'll be able to possibly beat the disease instead of just treating it.
Vicki had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicki's story and other life-changing stories, log on to bestdocsnetwork.com.
Have been living kind of with daily headaches for 13 to 14 years probably. I have done all kinds of different hormone therapy throughout the years, just trying to help my headaches and energy level, sublingual drops, compound pharmacy type stuff, and seen different doctors, and had been driving back and forth to Austin for years. And a lot of it I knew was hormone related and a lot of it allergy related.
Pellet therapy's been around over 30 years. This is bioidentical estrogen and testosterone, and you think, well, what is bioidentical? Bioidentical means it's exactly what your body makes. It's not derivative, it's not a synthetic, it's what your body already makes.
They draw blood work, and that takes about a week, and then you come back in and he inserts the pellet into your hip, and it's about, he says, the size of about rice. Depends on how much you need as to how many go in at one time.
The pellets in the females, they last for 3 to 4 months. The pellets in the males, they last for 5 to 6 months. They dissolve as you use them up. Now, how long they last depends on your cardiac output. So if you're super active, they may not last quite as long. If you're a little more sedentary, they may last a little bit longer.
Very simple procedure, just deaden that area in his office. It's an outpatient thing. I mean, it just feels like just maybe a little sting going in. That was about it. And you wear a bandage for, I think it was like 5 or 6 days, and you can't swim and get it, extremely wet like that. But other than that, it's just a little bit of soreness, and within 3 to 4 days, really being able to tell the difference.
By not taking a synthetic estrogen for women, it doesn't go through the liver, so you don't have quite the effect on lipids, and you have more reproducible, constant levels of estrogen.
I tried so many things before that it was kind of like, oh yeah, I'll try anything to feel better, just to feel more like myself again. The difference for me was just knowing this could last anywhere from 3 to 6 months, and I'm not having to remember to put a cream on every day or take a pill every day or something like that. It's just, it's done. You can forget about it and just feel great and go on and not remember to do something every day. I just feel like I'm not as tense all the time since I've started this.
As always, for more information on any of the doctors you've seen on today's show, go to our website, bestdocsnetwork.com.
And of course, if you're looking for a doctor that may help your needs, head to the website, bestdocsnetwork.com. Right now, it's time to head to our next doctor, Dr. Clay Cockerell.
We hear when you're a kid in school and all talking about having good hygiene and keeping your body clean and this sort of thing. It is very important. Most people don't realize that there are a lot of very dangerous microorganisms out there. There are things like staph, there are viruses, or all sorts of things. We hear stuff in the news about the avian flu and all these sort of things. And if you don't use good hygiene, you don't keep your hands clean, if you take your hands, touch your nose, your eyes, your mouth, those are ways that you can transmit diseases to your body. And there are some organisms out there that just by being in certain situations you can be exposed to, like this very dangerous methicillin-resistant Staph aureus, the MRSA that a lot of people have heard of. That can really be a very dangerous bacterium. And we're finding more and more of these cases are acquired in the community. Years ago they were only in the hospital, but now we see a lot of people just getting them just in general. So there are a lot of things like that that can cause problems that people don't understand where you can actually acquire one of these infections. For that reason, it's very important that people do keep their skin clean, that they do wash their hands relatively frequently or use one of the hand cleansers, and especially if they are a carrier of something like staph, to use some kind of measure to keep their body from developing a boil or one of these more dangerous infections. And so as a consequence, after you've been in that environment, you really ought to use some kind of a measure to sort of sterilize your skin, so to speak, and make sure that you take either a shower or wash your hands or something at the very least to make sure that you're not going to actually be colonized with one of these organisms that can lead to a more serious problem. One of the ways that we're kind of excited about is that we've developed this new bleach-containing wash. Bleach is very strong antiseptic product. It actually kills just about any bacterium, kills a lot of other things like viruses and even fungi. And if you use something like this, it will cleanse your body quite well. And if you use it on a periodic basis, you can maintain your body from actually getting colonized and keep it sterile or keep it cleaner for a longer period of time. So we recommend using something like that or one of the antibacterial soaps or something to keep your skin from getting one of these serious infections.
Growing up, horses were a big part of my life. I rode every day, several horses a day, and competed through high school. The main problem I was having in my low back was that the discs were degenerating, and I was told it was common in 60-year-olds, not in 30-year-olds. I had some tears that were leaking fluid and was having pain and discomfort down my legs that was keeping it where I couldn't sleep and was just in chronic pain. Did therapy for my back but still had issues. Slowly things started to go, like riding the bicycles or certain chores around the house.
I generally tell people that surgery is the last thing that we want to do. If the pain is so severe that it starts to interfere with your life, your hobby, your friends, your work, then it might be something that you should consider. If you're in that situation where you have to come home and spend your life dealing with the pain, then surgery is probably something that's a consideration if you've failed all the other conservative treatments.
Being that I live in Kansas City, I was from the Dallas-Fort Worth area. I had seen a few doctors in Kansas City and not really gotten any definitive way to get relief. After seeing the Best Docs episodes and watching Dr. Myles, I decided that he would be a good person to contact, and he was willing to look at my information and tell me if he saw anything. And he did see several things that my doctor in Kansas City did not see.
Generally with the surgery process, our goal is to decrease your pain, and our main goal is to get rid of your pain. So that's what we're trying to do when we offer you the surgery, is to get you back to living your life the way you were beforehand with pain freedom.
When I heard other patients talk about achieving pain freedom and that was Dr. Myles' goal, It sounded like a nice idea, but I didn't really think it was possible for me. It's been 3 months since the procedure, and I feel better than I can remember feeling. I thought I would be able to return to riding in January, but now he has told me I can move that up to next month. I'm very excited what he's been able to give me and really have given me what he promised, which was pain freedom.
Many of us live with pain, but you don't have to. Pama's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of Pama are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PamaInc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. Pama, pain freedom. Go to PamaInc.net.
The Best Dogs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
In this week's Best Docs Network special report, we take an up-close look at the LifeWorks Group. They help individuals with their mental health.
Before I came in, my life was really kind of in shambles. I didn't know where I was going. I was hurt. I was in a lot of pain. Really numb. This was the last-ditch effort coming here to LifeWorks. I had been referred to Melanie Wells.
I had been working in a variety of different practices for years, and I'd worked alone. I'd worked alone in a group. I was really frustrated by the lack of collaborative input. One day I was driving along Lover's Lane and I saw some space, and I thought I just had this vision that I wanted to have a collaborative team to work on cases together. Collaboration for us involves complementary specialties. There are more than 20 people on staff, and we try to thin slice our specialties so that we're not competing with one another, we're working together as a team.
My first impression of LifeWorks was this is very different than the other therapist office that I had tried to go to. Not so clinical, not just very relaxed, very easy. The people were very easy to talk to. It made you feel very comfortable and welcomed.
I try to look at a case from every possible direction, and as the clinical director, I'm going around the room making sure that I hear from anybody involved in an area of that case that might have something to offer. I want to know what everybody else thinks about my cases. Having 20 people in the room that have 20 different points of view is extremely helpful to the clients and to all the therapists involved.
One thing I really like about coming here is that I kind of get more than one therapist at a time. They take the time and work together, maybe discuss my issues. It completely feels like I'm going to a friend that knows exactly what's going on to me. So easy to talk to.
We believe that therapy starts with the phone call. So when a client calls in, we want them to feel welcome, and we want to be able to give them exactly what they need. Part of my vision for LifeWorks is to train therapists well, but also I want to be able to offer services to a wide range of individuals. I don't think money should ever be the reason not to come to therapy.
I don't even know how I would thank Melanie for what she has done for me. Words are not enough. It is invaluable what she has done. I love her to death. She's fun and just a really sincere person.
Catherine suffered from migraine headaches, which kept her from running. But now she's back running again, thanks to Dr. Brian Soren. To find out more about Catherine's story and other life-changing stories, log on to bestdocsnetwork.com.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
My son is 7 years old and he has really severe eczema, and because of that he has battled with bad staph infections over the years.
His eczema became more severe over time, and it became what we call lichenified or thick, and so we were having difficulty controlling the atopic dermatitis, and secondarily he was developing skin infections on top of the atopic dermatitis.
And about 8 months ago he developed a really bad staph infection, and usually we can kind of keep it under control by doing bleach baths or just finally getting an antibiotic for it. So we had made an appointment with Dr. Ghali, his dermatologist, to go ahead and get an antibiotic. And when we went to see him, he said, before we do this, let me introduce you to this new product and have you try it out first before we have to do the antibiotics.
Beginning in May, we started to implement CLn Bodywash, which was a product that we were currently studying in atopic patients who had recurrent skin infections.
Actually, after a week of using it, I noticed his skin kind of was showing some improvements. It started clearing up. And then by the time we went and saw him 2 weeks later for our follow-up visit, Andon's skin was almost all the way clear. So we continued to use it, and now we use it about once a week just as a precaution. He can use the product himself. I don't kind of have to measure the bleach out, stuff like that. He just kind of does it in the shower. It lathers up like a soap. We can travel with it. We've taken a few vacations. You know, we just throw it in the suitcase with everything else.
He went from a very severe patient to more of a mild to moderate patient. And in the realm of atopic dermatitis, that is a huge improvement. And what it means to the family is that this child can sleep better. It also means to this family that the dynamics change in the house. Parents can often get the rest that they well deserve, and the kids can function in school a lot better.
His skin just continues to get clearer and clearer, and so far in the last 8 months he has not had another breakout, and his skin has looks the best it's ever looked.
Bonnie has a beautiful baby girl, and she credits obstetrician Patrick Allen for possibly saving her life. To find out more on Bonnie's story and other life-changing stories, log on to bestdocsnetwork.com.
We treat a lot of various diseases that have chronic pain, and musculoskeletal pain is one of the big categories. Within the category of musculoskeletal pain, you have people that have fibromyalgia, lots of other directly related skeletal problems, and one of the more controversial diseases that you have is chronic Lyme disease.
I had been experiencing pain from my head to my toes, and I had been to numerous doctors, and I knew there had to be something different, something better, because I knew I couldn't live this way and I did not know what the pain was. I found Dr. Shaw in 2002. During our first visit, he asked me where my pain was, and I said, there is not a place in my body that I do not hurt. And he said, well, fibromyalgia, you don't hurt from head to toe. I said, have you ever been tested for Lyme disease?
Gloria had several problems. She had the myofascial pain, she had joint pain, and still does. She had what we call neuromatous. She'd had some nerves operated on because of pain. She has severe headaches, and some of her headaches are vascular, similar to migraine.
I get to visit my family that live in Oklahoma. I can make an occasional car trip. I can do things that I didn't think I was ever going to be able to do again. He listens to every ache and pain you have, and because of the medications in his treatment plan, we have got to where I am today.
Several years after we started treating Gloria, one day she came in all smiles, and she said, for the last 2 weeks, I've not hurt at all. In someone that's had chronic pain for years, it's an incredible miracle.
During my visits with Dr. Shaw, one of the things that we have discussed is not only mentally, but physically, to achieve pain freedom. And each visit, I feel like we are getting closer and closer to that objective.
That will do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives.
That's right. And for more information on any of the doctors that you've seen on today's show, just head to our website, bestdocsnetwork.com.
All right, head to the website as well to find the right doctor that may help your needs as well.
That's right. If you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.